Hi guys, Dr. Rob Barrington here with some more nutrition advice. I'd like to talk today a little bit about lactose intolerance, about calcium intake and about dairy. Now calcium is increasingly being seen in Western nations to be borderline deficient, borderline insufficient in many people. And this is surprising considering the fact that in the West we have access to a large supply of foods, a large range of foods. We have access to dairy products, which are a reasonable source of calcium, and we also have access to calcium supplements. And despite this, despite the potential to be able to supply ourselves with enough calcium, many people are actually borderline deficient in calcium. And this is worrying because the nutritional literature is showing that those people with the highest intakes of calcium generally have the lowest body weights. In other words, there's an inverse association between body weight and calcium intake. The reason that calcium may be an effective weight loss nutrient is not actually known. There are a number of theories. Calcium may bind to fatty acids in the intestine, and this would allow the excretion of the resultant soaps. They would be insoluble and they would pass straight through, and therefore fat absorption would go down. Calcium has also been shown to possibly regulate appetite. It increases satiety, so those people with the highest intakes of calcium perhaps are less hungry. And thirdly, calcium is also required intracellularly for correct insulin function. So those people with a deficiency of calcium are more likely to have insulin resistance. So there's a number of reasons why optimal calcium intakes are important in terms of maintaining correct body weight. Now, the vast majority of people in the West are borderline deficient in calcium because they eat a typical Western diet, and the typical Western diet is deficient in micronutrients. Now, this is even more problematic for those people who are lactose intolerant because they cannot consume dairy products. And really in the West, dairy is one of the main sources of calcium. It's not really a great source of calcium because there are problems associated with consuming a lot of dairy products. Calcium is also present in plant foods, and therefore if you eat a traditional diet that contains a lot of plant foods, you can supply a lot of calcium in the diet without the need to rely on dairy. But the fact is that most people do rely on dairy to get their calcium, and those people who are lactose intolerant obviously don't have that benefit, and they're even more likely to have lower intakes of calcium as a result. Now, what can those people who are lactose intolerant do in order to be able to consume dairy products, or a certain amount of dairy products if they want to? Well, the first thing they could do is they could possibly take a lactase tablet. Lactase is an enzyme that digests lactose. Now, if we have a look at the physiology of lactose intolerance, these people who have a deficiency in lactase, the enzyme that digests lactose, if they consume dairy products, they consume too many dairy products. Those dairy products go into the small intestine. The lactose sugar in the dairy products is not digested because they're deficient in the enzyme that does so. Those sugars then pass into the large intestine where they are fermented by gut bacteria, and those gut bacteria, as a side effect of digesting the lactose sugars, produce a lot of gas, and that leads to bloating and flatulence, and that is why you get the symptoms of lactose intolerance when you consume milk if you are lactose intolerant. So taking a lactase tablet provides the enzyme that is missing genetically and can actually provide some relief and allow the consumption of some dairy products. Still, it's not 100% effective if you take lactase tablets. It's not as good, obviously, as if you're producing the enzyme endogenously in your intestine. But there is some relief there for people who do want to consume some dairy products. Another thing that you could do is that you could actually consume yogurt. Yogurt is a fermented product. The sugars within the milk, the original milk, are broken down. They're converted into other substances by the bacteria that are fermenting the yogurt, and therefore the lactose content of yogurt is much lower than milk, and therefore there is less of the lactose to cause a problem in humans. Yogurt also has another benefit in terms of the fact that it contains residual amounts of an enzyme called Betagalactosidase. Now, the bacteria that ferment the milk also contain an enzyme that can break down the lactose, and that enzyme survives the fermentation process and is present in the yogurt. And when you eat the yogurt, you consume obviously some of that beta-galactosidase, and any residual lactose that is present in the yogurt may actually be digested further by this residual beta-galactosidase in the yogurt. Yogurt appears to be very well tolerated by those people with lactose intolerance. In fact, if we look at the world as a whole, the vast majority of the world's population are actually lactose intolerant. Most humans actually lose the ability to produce the lactase enzyme during their adolescence. By the time they get to adulthood, they've developed lactose intolerance. That is the genetic normal position. It's only a small number of people in the Western nations, so that's the United Kingdom and the colonies of the old United Kingdom, such as America and Australia and New Zealand, that retain this this ability to produce lactase into adulthood. So the consumption of ready-made breakfast cereals with milk, for example, is actually only really occurs in a very small number of the world's population in those Western countries. The vast majority of the rest of the world can't consume milk because they're lactose intolerant. And they actually do, to a certain extent, rely on fermented dairy products such as yogurt. It is quite a popular food outside of those Western nations because it is tolerated by people who are lactose intolerant. So those people in the West who maybe are worried about their calcium intake, and they're worried because they don't consume dairy, and they're not, obviously they could take a supplement, but they'd like to get more calcium from their diet. Yogurt is a very good food that you could incorporate. The best way to try yogurt, if you're lactose intolerant and you're not sure whether you tolerate it, is just have a very small amount of it and see how well you do tolerate it. Generally, the studies have shown that yogurt is really not problematic in people with lactose intolerant. Most people seem to be able to consume yogurt, and then obviously you can substitute where you would normally have milk. You could substitute it, for example, with yogurt, and that would allow you to consume dairy products. If you are very lactose intolerant and you can't tolerate milk, yogurt, and the lactase tablets are not effective, obviously the best way to get calcium is through your food. There are many other foods that contain calcium. Plant foods are rich in calcium. Many vegetables contain high amounts of calcium. They also contain other important minerals such as magnesium and potassium, and they're usually in the correct balance in how we need them. In other words, they have high amounts of potassium, low amounts of sodium. They also contain calcium, magnesium in the right kinds of ratios. So plant foods are very good sources of calcium. You can get calcium, for example, from eating fish. The bones in fish contain calcium. Calcium is also present in many grains. So you don't have to turn to supplements to get good levels of calcium in your diet. If you do wish to turn to supplements, they are readily available. They are quite cheap, and they are a good way of supplementing your diet with particular minerals. However, you must be very careful in supplementation with minerals, because minerals are required in a balanced ratio. If you consume any of the minerals in too high amounts, it will cause an imbalance in your biochemistry in your body, and this will cause long-term health problems. So that is why I always recommend getting your minerals from food. If you do have a particular need for minerals from a supplement, the best types of supplements to take are those supplements that contain a range of minerals in the correct kinds of ratios that you need in your body, and that will help you maintain your health. Obviously, taking calcium supplements on their own is not really recommended, as that will cause an imbalance in other minerals. So I would suggest that if you're lactose intolerant and you can't take milk, you can't consume yogurt, that you try and get as much calcium as you can from other foods.